This section of the online course is going to look at all aspects of calf and Achilles rehab, prehab and mobility exercises. It's very important we work these two together because they're so reliant on each other, because the tendon attaches the calf muscle to the foot. Now, if the calf is tight, it will pull on the tendon and create tendinitis. If the Achilles is sore, we'll overcompensate and not use the calf as much, so they work with each other. I have experienced really bad Achilles tendinitis in the past, so this section is very passionate to my heart. And one of the more notable athletes I've worked with on this area, he had a really bad Achilles and calf tightness, was the England and Manchester United striker Teddy Sheringham. In fact, I worked with Teddy in this exact same gym that we're going to look at in a minute. The first exercise in the Achilles tendon and calf rehab section is an isometric hold. This involves the person just using their body weight as resistance and holding the position for 20 to 30 seconds. So you can use some implement for support. Stand with both feet hip width apart, toes facing forward, and simply what you do is stand all the way up on your toes, holding that position for 20 to 30 seconds, and that isometric contraction generates strength in the calf and the Achilles area. The second exercise in the calf and Achilles tendon rehab section is an isometric hold with load. So we get some type of implement, whether it's a plate, a kettlebell or a dumbbell, or even a brick or a block, and we use that as resistance for the calf region. We can use an implement for support. It can be the side of the rack or the bar. We make sure we have our resistance in front of us and quite simply go up on our toes while our feet are hip width apart, and we hold that position for 20 to 30 seconds with the load creating more resistance. And that exercise is an isometric hold with load. The third exercise in the Achilles tendon and calf rehab section is dynamic body weight calf raises. So we're using the body weight as resistance. Our setup is feet hip width apart, toes pointed forward, and we dynamically raise up onto the tops of the toes and then we lower under control. So dynamically raise up all the way up into the toes and then lower back to the starting position. As a variant, some people struggle sometimes to keep their toes pointed forward. So what may help with this is placing some type of ball between the heels. Make sure the toes are pointed forward. Squeeze on the ball, raise up under the toes and lower with control. One more time. Dynamically raise up using the body weight as resistance up under the toes and then lower under control. And this exercise is dynamic calf raises using body weight as resistance. The fourth exercise in the calf and Achilles tendon rehab section is single leg dynamic calf raises. So as it says on the tin, we're going to use one leg at a time. So we can use an implement for support, stand on one leg, and then we push up dynamically up under the toes and then lower under control. So push up dynamically all the way up on the toes and lower with control. One more time. Push up, lower with control. We change legs. Left leg, push up under the left toes, lower under control. Push up nice and high. I can use the bar for support if needed, and lower. And last one, push all the way up and lower under control. And that exercise is single leg dynamic calf raise. Single leg calf raise with load. So obviously we use some type of implement to create resistance for the calf, whether it's a plate, a can of beans, a bag of sugar, a bag of potatoes, or even a brick. So we set up holding the load in one hand. We can use the other hand for support if need be. and then we dynamically raise up on the calf on the toes using that load as resistance. So we go all the way up onto the right toes, hold and lower with control. Raise up and lower. Then we change calves, raise up all the way to the toes and lower with control. Right the way up, really pushing the toes into the ground and lower. And one more, push all the way up and lower under control. This exercise is a single leg dynamic calf raise with load. The eccentric quadruple progressive exercise we're going to show you. This is the actual exercise that I worked with in Terry Sheringham, the England and Man United striker, on this plate, on this rack, in this room a few years ago. So all you need for the setup for this exercise is some type of height, whether it's a step on the stairs, whether it's a brick, a plank of wood, or even a breeze block. I'm going to use a foot plate for this. So the first exercise in this quadruple series is called the double leg eccentric exercise. So to begin the exercise, we go up on the toes and we very slowly, around 4 to 5 seconds, lower the foot to go either level or below the height of the plate. We then push up again on both feet, and then we very slowly, eccentrically or slowly lower both feet down to level with the plate or below the plate. So up on both feet and then lower slowly down to the level of the plate. Once we've got competent and we've mastered this section, we then progress on to the second part of this, which is a single leg eccentric raise. So we go up on one foot and again lowering for 4 to 5 seconds, really slowly under control on that single leg. Up and then lower slowly. And then we swap legs, moving on to the left leg. Up, low for 4 or 5 seconds. And I recommend doing this for 10 to 12 reps on each leg. So that's the double and single leg eccentric calf raise using body weight as resistance. Once we become competent and we feel comfortable in those exercises, we then introduce those exercises with a load. For this purpose, I'm going to use a plate. So double eccentric calf raise first with load, up on 2 feet, and then we're using our body weight plus the resistance as load. Lower for 4 or 5 seconds, up on 2 feet, and then lower for 4 or 5 seconds. Once we become comfortable of doing this exercise, it might be over 5, 6, maybe even 7 sessions. We can then go to the final part of this progression, which is a single leg eccentric calf raise with load. So I'm going to use the right calf first, hold the load in my left hand, right hand for support, all the way up on the tiptoes, and then lower slowly for 4 or 5 seconds. So this time, not only am I using body weight for resistance, but I also have a plate for extra resistance. Change legs, left leg, up on the tiptoes on the left foot, and then lower slowly for 4 or 5 seconds. Up on the toes, and then lower really slow. And these chains of exercises are called eccentric calf raises with body weight using double and single leg, and then eccentric calf raises with load, double and single leg. Tiptoe walks. Tiptoe walks involves the athlete or the individual walking on their tiptoes with a very slight weight to really load the upper part of the calf. This creates a lot of tension and strength in the calf area and is one of the latter stages of the rehab section of this online course. So the first part of the movement is we stand up on our tiptoes with weights in our hand. And then we walk slowly and controlled on our tiptoes using the weight as resistance. And obviously there's a lot of balance involved in maintaining the correct foot position throughout the exercise. So to start the exercise, go up on both tiptoes, and then we just walk slowly up on our tiptoes, holding the weight in each hand, just in a constant, controlled manner. We turn, and then we walk slowly and controlled on our tiptoes, using the weight as resistance. So this really involves a balance element as well in maintaining the correct foot position throughout the exercise. And this exercise is called the tiptoe walk. Banded ankle dislocations. Studies have shown by doing this exercise, it creates a greater range of motion in our knee to wall flexibility test, which is a real measure of how mobile and flexible your calf area is. How we do this is we get a band and we securely wrap it around the ankle. We then secure the other end of the band to a stable and strong structure. Once we've achieved that, we then very carefully create tension in the band, which will then create small slight separation between the ankle and the tibia bone, which is your shin or your lower leg. And then we work out a distance that we feel a slight pull in the ankle for roughly about 45 to 60 seconds. We do that on one leg and then we swap to the other leg. And that separation will allow the calf region to become slightly more mobile. And that exercise is called the banded ankle dislocation. The exercises you've seen in the calf and Achilles tendon rehab section are real life exercises. These are exercises I've used with multi-million-pound football players, I've used with amateur tennis players, and I've used myself in rehab my own Achilles tendonitis.